So I was going to talk a little bit about patella tendinopathy or patella tendonitis. Essentially what it is, it's an abnormality in the patella tendon. That's the tendon that sits between your kneecap, your patella, and your shin bone, your tibia. And essentially it can be chronically inflamed over time. The causes for this are not entirely fully known, but what is known is there's a high amount of force that's put through this tendon. This is approximately 6 to 8 times body weight when you do a lunge or a squat, which is quite common in tennis, badminton, volleyball, those sort of activities. So for example, I'm near enough 13 stone, so if I take a squat down and bend up, that's about 80 stone is being transferred through my patella tendon. And that's why it's a very common sporting injury. For example, Rafa Nadal has suffered this for a long time and affected his tennis career. The symptoms you're likely to get are pain over the front of the knee, and often initially will be only after your exercise and may not initially affect how you play and the quality of how you play. With time, if you ignore this, the symptoms can progress and you can get pain during exercise or very early after you've started it. And it's the pattern of the exercise and the pattern of the pain which is characteristic. Regarding diagnosis, then the history and the relationship to exercise is quite characteristic. Usually we examine the knee and make sure there's nothing else wrong with the rest of the structure of the knee. And then various investigations can be done. Often we start off with a plain X-ray to exclude any other conditions such as arthritis, but commonly it's picked up with a MRI scan. With regard to treatment, mainly it's treated without surgery. Physiotherapy can be considered in the chronic conditions. In the short term, rest ice, compression and elevation are obviously useful. It does take several months to recover from this, and the reason for this is that all tendons and ligaments have a very poor blood supply and therefore they heal very slowly. Overall, you need to reduce the level of activity and the level of stress through your patella tendon in the first instance, allow it a chance to recover, and then very gradually and ideally guided by physiotherapy, reintroduce activity. But what can be frustrating for patients and doctors alike is it can take several months, sometimes several years.